Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, May 29th. Welcome to another one of our weekly video chats with Ed Brubaker, President and CEO of Living Branches. Nice to see you again.
Good to see you, Alex.
Well, let's recap with a state of the situation, perhaps, countdown of where we are with our coronavirus testing. All of this is, of course, available on our website. So if people would like to look at this information, it is there. At our Dock Woods campus, we continue to have only residents testing positive who are on campus. The only ones that we have are in Dock Terrace. And we did some more testing this week, and we had more negatives coming back from that, which we were very pleased with. But there are still some in Dock Terrace who are testing positive. We have 6 staff members at Dock Woods who are out right now with a positive test. At the Willows of Living Branches, we do not have anyone, staff or resident, who's tested positive at this point. And at Souderton, we now, again, have one staff person who has tested positive in Parkview, but no residents who've tested positive. And Ed, maybe you'd like to comment on our staff person.
Yeah, and this I would say has happened before at Souderton as well. So we don't want to be overly concerned, but we are paying attention. And one of the things we're going to do, because it is the memory care unit at Souderton in personal care, we're getting all residents tested just to have a baseline and see what's happening there. We did that last week in healthcare at Souderton. I think that was reported on the video last week. And we also plan to have the staff tested or ask them to be tested, the ones that may have worked with this person on that day. For me, it just illustrates how tenuous, I guess I would say, the situation is, and how I know we all want to loosen up restrictions, and we will over time, but it also points out that it only takes one. It really only takes one. And so somehow, as we move into the future, we're going to need to find ways of working with coronavirus, and we will do that. But in the meantime, we're learning all we can and trying to figure out what is the best way to work at this, and how can we best protect those that we serve, recognizing that nothing we do is perfect, but we will do the best we can.
Yeah. We had some interesting visitors on campus this week, speaking about learning all we can. Why don't you share who they were and what we experienced?
Yeah, we had, it was probably about 10 in total. And originally we were thinking it was primarily going to be a CDC, Center for Disease Control visit, but it turned out there was one lead person, a physician from CDC, a number from HHS, from various divisions of HHS, 3 persons from the Montgomery County Office of Health, I think they call it now, Office of Public Health. They were along too, kind of for the learning. And then they had come, and originally somehow Souderton was on the pick list, which was fine. But we also were interested in, okay, can you look at Dock Woods too? Because that's where we've had more issues, at least to date. And so they were very willing to do that. And so we didn't have to do this. This was a voluntary thing, but it was not a punitive survey or anything like that. It was really for them to come out and be helpful to us, look at our practices, look at our policies, do a walkthrough. They went in full PPE, walked through our units. So we were very glad to be able to host them. And overall, I would say it was a very good visit, very good people. The lead person, Dr. Dixon, she, I would say, was very empathetic toward our staff as well and the challenges that they're going through, particularly at Dock Woods with a number of cases there. But we really did have a good visit. It was basically all afternoon yesterday between both campuses.
It was interesting to me, I think so many times when we think about government, especially the federal government, coming to our communities, we don't necessarily have perhaps a positive feeling about that. But I was struck by how much they seemed to want to help us, and how open they were and how empathetic, realizing especially around what it means to wear PPE all day for our staff members, and what it means to work in an environment where you are faced with the possibility that you're going to lose someone that you really care about.
Right, and I think the thing we have to keep in mind is these persons were not from our survey agencies, so they were not the Department of Health or federal surveyors coming in to say, are you following all the regulations? It was from CDC and HHS, and really people that were looking at epidemiology and what we can do to become better. And so it was definitely a different type. I mean, we sometimes joke around here, oh, I'm from the government, I'm here to help. And it's like, you're kidding, right? But these persons, they were all very great and very interested in looking at things. One of the things I know I was keenly interested in is we have this major issue, or significant, let's say, issue at Dock Woods, and not so much at Souderton to date, and also at the Willows. What are we doing differently? Because we feel we do a lot of things the same. They really didn't point out anything, and they talked about putting a puzzle together, and if you remove one of the pieces, that could be the place that the virus gets in. It's just very hard to lock a campus down. And so while it would have been nice maybe to hear, oh, here is the smoking gun, they're coming back. They were actually back again today at Souderton to do some work, and probably over at Dock Woods as well. So they may be able to give us some things in the future, but overall, very complimentary on what we're doing, the way our staff cares for the residents, the way we're doing PPE, the way we're taking care of our HVAC systems, with the way we clean. So they had very good and complimentary things to say. They didn't see anything glaring between the campuses. And so while it would have been nice, as I said, to know that, it was also nice to know that we are being consistent. And that's probably the hardest thing. One of the hardest things about this disease is you feel if you do X, Y, and Z, you can nip it in the bud and stop it. And it's really, really hard to do that. And that's what they said too. This is a worldwide pandemic. It's not just in living branches. And so they reinforced that too, that everyone is struggling with how to keep this in check. So overall, I would say it was a very good visit, very helpful. They gave us some pointers. They're coming back, as I said, today to help fit testing of N95s. We already know how to do that, but it's always helpful to learn more. They want to watch staff don and doff PPE, personal protective equipment. So I think it's a good outcome, win-win, and we really do appreciate their time, because there was, between the county and feds, there were, and some local resources, it was 10 people, I believe. So it was a significant amount of resources that was being expended, and we appreciate that very much.
Well, and it can be helpful to have a second set of eyes.
Absolutely.
With a fresh viewpoint looking at what we're doing.
Yeah, that's really what I was most enthused about too, and also the fact that they actually walked through the unit. You know, they had their masks and protective goggles on and all this kind of stuff, or face shields, but that was very helpful to see as well, that they could eyeball things and make some recommendations.
Yeah, specific suggestions.
Correct.
Yeah. One of the things that they talked to us about is the possibility that they might be able to assist with some testing.
That's right.
And I know that that's, of course, been a hot topic in Pennsylvania and all over the U.S. now. We talk about it regularly, but they could be of assistance to us. Yeah,
that's right. And we had talked about this probably almost weekly on the video, because it's that important of a topic, number one, and it's something that really has been evolving, honestly, from the beginning till now. The county is giving different recommendations, and that's not to slam them for that. That's just really to say you learn more things along the way. The challenge is, if you test today and I come back negative, well, that doesn't mean I'm negative tomorrow or the next day or the next day. And I've said this before as well. So for me, ultimately, if we can get to daily rapid testing so we can also test visitors and families, that would be wonderful. But I can say, regardless again of what you hear in the media, it's just not as accurate as we would love it to be. And so there's some work to be done in that regard. But we are coming to the point, and we really believe that we need to do a baseline test of staff as well, particularly staff in the care facilities. So actually they're able to work with the National Guard and bring them in. And so we're working, going to be working at that. Bruce Alder and Kathy Schott are doing some work at that to coordinate that. That'll just be for the first baseline. So what we do after that, we'll have to figure it out. But we do feel it's important because it's been true for a while that we've known you have asymptomatic spreaders. They don't have symptoms, but they're shedding the virus. I heard recently as much as 80% of the people would be in that category. I'm not sure if that's really everyone, but suffice it to say, even if it's 40 or 50 or 60%, if you're spreading and don't know, in fact, the person at Parkview, she was very surprised and shocked that she was positive. And so, yeah, that's what happens. And so we feel we need to have a baseline, and we also wanted to immediately test all residents in Parkview, just as we did very early on. I think April 15th is when we did Harmony House. So you're learning new things along the way and trying to figure out new things, and testing is becoming an important element. And we always felt it was. Ultimately, daily testing would be wonderful. We'll see if we ever get to that point.
Well, clearly there's no capacity for daily testing.
No, there's not.
I mean, we've seen the speed at which we're getting test results back is already declining because so many people are testing right
that's
now.
Right, exactly. And I was listening on NPR today. They were talking about really at minimum across the country we need 900,000 tests a day, and we're not anywhere close to that. So yeah, that's really the issue. Mm-hmm.
Yeah. One of the other big things, of course, that's happening in Pennsylvania is that next Friday, supposedly, we're all going to yellow in the state's categorization, I guess, of where the counties are. And so while I, of course, would be delighted to throw open the doors and celebrate really a yellow status, that doesn't really mean much for us, does it?
Yeah, that's correct. And when you look at the difference between red and yellow for facilities, organizations such as ours, it really doesn't mean much. It talks about you shouldn't have more than 25 persons together at one time. We're not even going to be going to those points. We're not going to have small events for residential living in Summit View or Fisher Auditorium or anything like that. So churches and other places like that would impact in that regard. But as far as visitors coming, as far as residents needing to be in their rooms, that does not change from red to yellow. I say unfortunately, but yet the reality is we really need to be at that place. So I say unfortunately from the perspective of, wow, this has been a long time. But the flip side is we really need to make sure that we do those things that keep our residents safe. And so you're right, there really isn't a lot of difference. I would also say, even as we go to green, that doesn't mean that we're going to be green, because again, we're in a different category than the general public. We're opening up businesses in Pennsylvania. And so it is different for us. And it's different in residential as compared to personal care and healthcare as well. So we have a task force that's going to be working for that, on that, and working with the CRT. We also want to find ways of getting feedback, particularly from residential living residents, because they would be in a different category than the care facilities. But this is going to be a slow process. And I know hair care and hair salons were a big question coming in, and they are not opening till the green phase. And so, honestly, I did cut my hair a little bit last week because it was getting in my eyes, so I trimmed a little bit. But I'll be honest, one of the reasons I am not doing it is partly because my hair salon, or whatever you want to call it, the place I get my hair cut, is closed. But, we're in this together. And so while I might take a scissors to it at home, I'm not going to go out and get it cut somewhere because we are in this together. And if our residents can't, we shouldn't either. So that really is green phase for hair care.
And I was talking with my mom last night about this because this is a hot topic in our household. And she was sharing that her hairstylist has said that she's willing to cut hair at home. And so my mom had made an appointment because she just can't take it anymore. And the day before she was going to her appointment, she read a news article about a hairstylist who was cutting hair at home, who was wearing a mask, made sure everyone she was cutting the hair of wore a mask when they were in her house, and she was asymptomatic and ended up spreading it to 41 different people.
Wow.
So my mom canceled her appointment. She's wearing more hats, but the risk is real.
Yeah. And I know it's annoying and frustrating and all those kind of things, but this is the reality for us right now. I would also say we got some feedback too about residents in healthcare and personal care who may not be as able to do their own hair. And we did speak to the campus executives, and the care staff are really doing what they can to make sure the hair is washed and combed and taken care of. And so they are filling in for some of the things that the hair salon hairstylist would have normally done. So there are those provisions happening, but as far as the actual salon being open, that will not happen until at least the green phase.
And I think maybe just to recap there, so we know that yellow is coming. We have a subcommittee that is working on that. We actually will have some communication going out this afternoon, Friday, to residents so that they have a little bit more of a feeling of where we are. But it's going to be slow going.
Yeah, it really will be. And that's the challenge, but that's the reality too. And so we'll have to find ways to deal with it.
Yeah. Mm-hmm. The questions I had this week from residents were mostly focused on hair care and testing and visitation, which I think we've covered in all of this. So maybe I will just say thank you everyone for watching. Thank you to those who participated last week in our giveaway with the MHEP. We ended up having 36 people who entered.
Wow, that's great.
And we gave away 5 sets of tickets. So we'll have to look for some other fun things that we can do in weeks to come. But thank you all and have a great weekend.